My name is Sin Graham. My pronouns are they, them. When it comes to my sex, for the most part, I identify as female. For my gender, it's non-binary, queer, gender fuck, something in those realms. So I had top surgery back in April of 2025 and started coming to see you, I believe, right at the 6-week mark. Now, that had been at the recommendation of my primary care physician at All Brains Belong. They work a lot with trans folks in various stages of medical, surgical sort of transition. And I'd learned from them and from other mask friends of mine how important some form of PT or some form of scar work is after surgery. So right after surgery, I was really aware of how much my mobility was limited because of the scars, because not even necessarily because of pain at that point, but just due to the tissues really gripping onto each other and limiting my range of movement. So that you not only came recommended by my PCP, but also have on your website your talk specifically about scar work, about working with the tissues to help them release, was what led me to reaching out and make an appointment.
So how did the work seem similar to or different than you'd expect other scar work to be?
So I mostly associate that sort of scraping technique with scars, where someone takes basically like a blunt butter knife and scrapes along the tissue to break up the connective formation. Um, and this sort of blunt force approach to scar tissue is what I recall seeing pretty much everywhere else. So the idea of working very gently with the scar, with coaxing it open instead of forcing it open, was really intriguing to me. Particularly since I have hypermobile Ehlers-Danlos, which means that my body doesn't produce collagen proteins correctly, and scarring can be weirdly impacted by HEDS.